Thank you for listening. It's been so many years trying to tell the world that we have a problem. It's been more than 15 years screaming to the local authorities and the regional institutions and to the world, and nobody listened until now. And so I am very glad to be here. I've traveled from the other side of the planet. I don't believe in borders. I think we are just one human race and one big country of human beings. And I also think that those things that attack us as a unit, we should face them as a unit. So in 1998, at the Hospital Rosales, which is the main hospital in my country, we started noticing that there was this group of patients that they were coming every day, a lot of patients. We didn't have the resources to treat them properly. I mean, hemodialysis, transplantation. No, we had to use primitive techniques of dialysis, giving them 15 days or maybe 1 month or 3 months of survival time. But they were dying, and they kept coming and coming and coming, and nobody knew what was happening. So we started to count patients and to ask them in order to obtain a minimal epidemiological data. If you are expecting me to give you some medical insights or data, that's not what I'm doing here. I'm here to tell my story because finally somebody wants to listen. And I'm so grateful, and I'm so thankful for that opportunity. This is the Hospital Rosales, and you can see it's supposed to be the main hospital of the country. You are supposed to attend patients with heart problems, neurological problems, eye problems, every kind of third level medical attention, but no, it was absolutely saturated and overflown by renal patients, kidney patients. They were everywhere, even in the kitchen. We didn't know what to do with them, and nobody knew why. So we started investigating, and we found out that most of them were agricultural workers coming from the coastlands. Most of them were men, and they were younger than expected. So we realized that we were facing a silent epidemic of kidney disease that has been present unnoticed for years. That was more than 50 years ago. We started screaming, as I already said, trying to get attention to the problem. 15 years have passed and things have not changed. People are still dying without an option for a decent modern treatment. They die from a disease that can be prevented. At the same time, in Costa Rica, Dr. Ineke Vesseling from the University of Heredia and other colleagues, Aurora Aragon from University of León in Nicaragua, they all were noticing the same problem. At the beginning, we didn't know that we were related, but with time we found out that indeed we were talking about the same disease that was affecting the whole region, the Pacific Ocean coastal line of Central America, down from Mexico to Panama. We were seeking the same kind of epidemic, and we didn't have the tools to treat all the patients. So we knew that something was happening. We did our best, you bet. With our nails and our teeth, we did our best, trying to diagnose cases early, trying to provide them with medication, trying to avoid reaching stage 5 of the disease. That's when you need dialysis or transplantation. But since we noticed the problem, we started the records started to grow, and every year we had more and more and more patients coming to the hospitals, but we couldn't do anything to stop it. It's the recipe for a perfect, a silent massacre that has been going on for years, decades now, as we know with recent retrospective studies. We know that poverty, with strenuous work in hot and humid weather, and little access to clean water, and the difficulties to provide all these patients with modern treatments. If you put all this together and you add the global warming, then you get a silent massacre. This is what we've been trying to do, to bring information to the people, but it's little changes, little actions, trying to do something, but we were overwhelmed. There was no way that we could stop this problem. By 2005, we were already sure that the disease was related to environmental and occupational factors. We were talking about climate change, weather, the hot weather, and the working conditions and poverty itself. So many years, and El Salvador still has one of the world's highest rates of deaths due to kidney disease. It's right now it's 3 p.m. So in my country, which is more or less half the size of Netherlands, 6.5 million inhabitants, and by now 3 p.m. 5 people have already died of kidney disease. 3.5 of them are caused by this mysterious disease that is not diabetes, that is not hypertension, the usual causes of kidney damage. Something else was killing their kidneys, and we didn't know. We had this hypothesis that heat stress and working conditions could be the primary force behind the epidemic, but we weren't able to prove it. We didn't have funding to do studies. And as a doctor, it is frustrating to see patients come and die, because that's not what I was trained for. I was trained to save lives, not to keep mortality registries. It's frustrating. And what for? You tell me. Nobody should die of chronic kidney disease. It's a 21st century. It's a preventable disease. It's a treatable disease. And they shouldn't be even getting sick, because the working conditions can change. And maybe also we can change climate change. We can change the world together. Early in 2014, and thanks to La Isla and Solidaridad, we finally received some support for the research. We started doing our best, you bet. We started collecting information, sending samples, blood samples, urine samples to universities outside of the country. Now we had a little money to spend into research and investigation. So we were able to finally generate some scientific grade evidence to test the hypothesis, and this is what we found. So you don't have to be a genius or a Nobel Prize to know that working under such conditions will fry your kidneys. And even more, if you don't have access to clean water, and if you get $5 a day for doing so. So these little crystals that you see here, this is part of the latest hypothesis we have, and it's related to dehydration and uric acid. And this could mean a real mechanism for the development of the disease. And this is pointing out to the obvious, that people need water, rest, and shade to do their work. You may laugh if nobody will ask if you get a job here in Europe. Can I have water in my job? Can I have rest? Can I have shadow? Of course, no. That's normal. You assume it will be like that. But in my country, due to the poverty, the situation of the country, well, That's a luxury item. They don't have access to water, rest, or shade. So the WE program, my friends, will keep going and will further expand on this. But the good news is that one mill, finally, one sugarcane mill, listened to our begs, and the workers were already listening, and they were willing to do something. They were wishing to cooperate and to find solutions. So they were happy to cooperate, most of them. So we started what we think will be an important point in time, because there will be before and an after due to these efforts that we are doing right now. Together we can change the world. And we have a unique opportunity. It's once in a lifetime. And I've come from the other side of the planet. I've come from my country to tell you that we can change the world. We have a once in a lifetime opportunity to stop a silent epidemic. This will, I don't know if this will repeat or not, but we can make history together. And the last thing that I want to say today is that climate change will affect us all sooner or later. Right now it's us. We are the first to suffer the consequences of global warming, but in the end it will affect us all, because it's just one world, it's one global ecosystem, and it's one big human family. So thank you very much for listening. I want to say in front of you, thank you to Solidaridad for helping us, for funding, for providing all the help and the support to our projects and to our dreams and to our necessities, for listening finally to this silent massacre. Thank you very much.